Hello, it's Natsuya Uesugi, and today I wanted to talk a little bit about group again. Today was my third day at group, and like I said, we meet for a half day. And today I actually got to share. Usually they talk about um, so group session is group therapy, and it's also I am in a day program. It's called IOP, so intensive outpatient, and it's usually after you spend time in a hospital for mental health. They usually have you do an IOP or a IOP, which is an accelerated IOP program. And usually an accelerated IOP program goes every day and for a couple hours for a shortened period of time. That's why it's called accelerated. But a regular IOP program is like either 2 or 3 times a week, and it's for half a day. So some programs, they have flexible times. The program that I'm in meets in the morning and goes until about 1 o'clock. Today, so how does group start? So usually, the people gather, because of the restrictions with the virus, they do take your temperature, and so if your temperature is elevated, they're not going to let you on the floor. You do have to, so they take your temperature, and then they determine that you're good to go. You do have to, at the beginning, take a test to make sure that you are clear. And then they usually do, when you join the program, before you even join the program, you do have a kind of an intake interview, and they make sure that you're right for the program, and they ask you a bunch of questions and things about, when you were in the hospital. They also talk about, you get a chance to meet with, like, the nurse practitioner, who is usually a counselor or some type of, a social worker, or some type of healthcare provider that has a degree of some sort. So you do actually also meet with a psychiatrist. There are usually nurses in the program, as well as, depending on what kind of program it is, like for example, if it's an eating disorder program, then you're going to have possibly a nutritionist, as well as a psychiatrist and a counselor. Most times, again, I've had a group before, and usually it has been a bad experience. So this is actually interesting because in this group, I'm actually, I guess, functioning well, and it's actually working. I know that I have had group experiences in the past, and I have also talked about with my counselor, psychologist, that group hasn't worked for me. I've also had an experience with a social worker, that was a while back, and that was after a period where I had a previous hospitalization. That one was for a month, and that was, well, it was more than that. There was 2 different facilities in that case, and in that case I was coming from off the streets with no ID, so that was very different. So you went to kind of like the state system, which I tell you, don't go anywhere near that, because that's like quite frightening. Personally, I call that experience the horror hospital, and I like never want to go there again. It's horrible. And it's quite scary, especially, because in my situation, they didn't know who I was, because I didn't have any ID, and it took them, so I was there for, there's two different sides of that. There's like the normal side, and then there's the upgraded side. Both sides are bad, and Yeah, I don't even want to go into that. I'll go into some other type of. Well, we're talking about day program right now, but I'll talk about kind of the program before the hospital that I was in and how that was. And I'll talk about the intake process in the emergency room with the psychiatrist. So psych evaluation. So psych eval is what they call it. And that is what determines if you're going to be, put into the hospital at all for the specific thing. Okay, so we were talking about day programs. So it's my third day, and usually how it goes is like, well, our program, the other programs may be different. So our program is start off with a mindfulness meditation. So it's about 5 minutes. It's the guided meditation. There's usually music and like a singing bowl and mindfulness. So you're following along with. You can either do it. So I do it in with mudras and a pose. So I'm like this. How I do it. Some people just sit. But I do child's pose, so you cross legs, and then you have your hands up like this, like this, so like this. Just in your general meditation mudra. And mudras is the hand displays, hands sayings, and I'll go into some of those later too. But yeah, so you do that for the first 5 minutes, and then we do have a licensed practitioner who is the counselor, and she has a behavioral health degree. Usually it depends on a group, how large the group is. I know in the hospital before with group, it's usually been about, I don't know, 12 to 15 people. Here it's about maybe 8 to 10. I think I've only been there 3 times. So today we actually had different people. The first 2 times they had the same people in them. This time some of the same people, but we had additional people. And I know that my program, it does different things. So I go 3 days a week, and depending on what day you're going on, so they have days for focus on detox and drugs. Drug addiction and dealing with that. They have another day that deals with PTSD, so I'm in that one. PTSD and first responders, they have that. And then they have just a regular program, with no special thing. And so those are the different programs that are available. And my program specifically is more dealing with PTSD and trauma, and most of the people in the group do have some type of trauma, and so we're actually going to be doing some focused trauma work, which is good because it's definitely something that I'm going to want to take part in. And also, like I said, so it's a liberal program, and it has people of all different, stripes and whatever, and also gender and sexual orientation. So I'm in there as intersex trans. And I think that there were other identities there as well, which is good. Now, like I had said, I got kicked out of my other day program like within like the first day, and I think it was just like way too Republican straight for me. That was this is in the United States, so that wasn't going to work for me at all. And it was absolutely obvious that like the first day, the first couple of hours of the program where I participated, and then kind of like backed off halfway through. Okay, so let's go on. So you have the mindfulness meditation, and then we talk about a specific topic. So not this time, but the topic last time, we talked about tapping. So it's like tapping on pressure points, like acupressure points, like Ayurveda type thing. So it was things like tapping on your head, tapping on pressure points like here, and there's like some at the end of your eyes here, and then here. And then so they showed us the different first the counselor told us like how the tapping works, and then also went into what that how it in how it helps you do, because we're a PTSD group. We're talking about stress relief. And so we talked about how that reduces stress. So, like, if you were to sit here and do tapping, like you tap on the top of your head, you go around in a circle like this, it actually, calms you down, and it can actually work. So, if you do it for, like, I don't know, 10, 15 times, just around and around. Now you can go there like you would like say a statement of intent. So kind of like I want to be able to reduce my stress when I feel a flashback coming on, and then you'd say your statement out, or if I feel like I'm having a panic attack, I am going to take a moment and take a breathing for 5 seconds and then do the tapping. So so if I have a panic attack, I'm going to calm myself down. So you would do your breathing, inhale in and out and in and out, like, 4 in, so, 4 counts in, 8 counts out, and then you would go in a circle and do the tapping like on your head, and then you can do other pressure points as well. And that usually works to calm you down, and that can actually work for a significant period of time. After the topics, there was usually 2 different topics. Near the end of the program, you do have a time of sharing. And so, again, depending on the number of people in the group, not everybody shares on the same day. So, my understanding is, again, like I've only been to one AA meeting, outside of a hospital setting. Because like in that one hospital say you were required to either go to AA or NA while you were in the hospital. In the program, in the hospital I was just in, we didn't have that requirement, but they did have group therapy. Because you're in the hospital like all day long. You did have group therapy every day, 3 different settings. One was art therapy with music, and sometimes some like yoga and chair yoga. And then you had another one with where you dealt with like behavioral things like self-care, or reducing negative self-talk, or how to deal with stress, or how to calm down from a panic attack, or what do you do when you have a flashback, or how do you stay in the present and not dwell in the past. How do you make a boundary and keep it? How do you deal with difficult conversations? How do you not take things personally? Topics like that. So that would be like your behavior process group. And then you would have kind of a life skills group that would deal with, like, so if you're autistic, like how to make a routine and stick with it, or things like how to reduce stress around finances, or how to have a difficult conversation with somebody that you care about, like you're working on relationships and communication, or things like, how to, once you get out of the hospital, how do you make the transition back to real life, or how do you introduce back into your living environment, especially if you have like a family, how do you do that? So we have some of that. So on to the day program again. So you have your mindfulness meditation, then you have your two different topics. One of them is usually health related, so like I said, the tapping one. And then the other one can be behavioral related or life skills related. And at the end, you have sharing. So the way that the sharing is done is that you go around the room, and anybody who wants to share, they can speak up, and then they get about like 5 to 10 minutes to speak about a specific topic that is important to them. And after that, then the counselor will ask, "Are you open to feedback?" Because everybody in the group would have heard what that one person, spilled the tea. And then after that, the counselor would ask, "Are you open to feedback?" And then the first person who would be giving the feedback would be the counselor who's running the group. Sometimes in group you do have a counselor, you also have a nurse or a psychiatrist. So I have been in groups that have been run by psychiatrists. I have also been in groups that have been run by social workers, and that have been run by a counselor or a psychologist. And then I have also been in groups that have been run by nurse practitioners. So it depends on what you're doing, and what the group is. So, for example, the art therapy group was done by an educator, so somebody who had an education degree who also focused or did a elective study in behavioral health for adults dealing with mental health challenges. Now they have different programs for the program. When I was in the hospital, luckily it was very diverse, and that was actually very awesome. Of the different types of people, so there were some indigenous people, there were people from rural areas, there were some tribal citizens, there were some black people, there was some Jewish people, there were some people who were Christian, there were people who were Buddhist, there were people who were Muslim, all different ethnicities, and having different types of issues. And so, like I said, some were detox, some were just mental health, and some were transition from being kind of in a lockdown situation. So I guess you would say coming from being in jail. And so there's a transition period from there. So again, going back to group, sorry, I have ADHD, I'm jumping all over the place. Going back to group, so the sharing, so the person who would decide to speak would share, and then the counselor would ask, "Are you open to feedback?" Now, this is a decision, so if you're not open to feedback, then there is no feedback given. If you're not open to sharing, you don't have to. It's kind of an elective thing. And so I decided to share today on my third day because I had not shared before, and I actually got to see what the sharing was like on the first 2 days, so that was kind of interesting. So this time I did get to share. I shared a little bit about, we had talked in the previous session about some of the topics related to stress. And so I wanted to share something related to that. And it was actually very helpful for the group sessions that I had been to, because I was able to actively use the skills that I had learned in group. And that was actually kind of great, because instead of, I think my last post was about, or 2 posts ago, was about having a panic attack. And this time I was able to use some of the stress reduction skills from a previous group session to reduce the amount of time it took to for the panic attack to last and to be able to calm down from it. So it was actually very helpful. The other thing too is because, with all the fun little narcissists I have had to deal with recently, I have kind of lost my ability a little bit to make friends and meet new people. So it's actually nice to be, because I'm, kind of like backed away from BS. So I have decided that anything that is not in my benefit needs to be out of my space because it lowers my vibration. Okay, and at this time in the new energy, we want to make sure that we're thinking positive talk and we're not like negative self-talk and shaming and guilting ourselves and putting ourselves down. And that's another thing that we deal with in therapy, is learning to appreciate and be grateful for things, but also learning to kind of like not be so negative at yourself. A lot of people who have been through narcissistic abuse have a lot of negative self-talk and a lot of shame and things like, why were you in a destructive relationship for so long? Why didn't you just leave? Or, when you're in a narcissistic relationship and you're trying to talk to like a friend or something, they don't understand the whole narcissistic dynamic, and it doesn't make any sense because you're like, well, why would someone say crazy stuff like the sky is pink? The sky isn't pink. But there's a specific way that a narcissist will gaslight you, which is like totally lie to you and say the sky is pink. And you're like, dude, the sky is not pink, it's blue. And then they'll go, well, that's wrong. And they won't tell you why the sky is pink. And they won't like hand you a pair of rose-colored glasses and say, put these on, and then all of a sudden the sky is pink. They'll just make up some nonsense that's 100% not true, and then move the goalposts, and then blah, 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 blah. The sky is pink 200 days in a row, and then all of a sudden you're sitting here, maybe the sky is pink. So you start doubting your reality because the crazy making conversation that the narcissist is using is to keep you on edge, like walking on eggshells, because you never know at any given moment. It's like, you could be like totally sitting there and be like totally calm, and like that, the narcissist is just gonna go off on you for like no reason. Like, they ask for like, I don't know, a glass of wine, and then you give them the glass of wine, or you give them the bag of potato chips or whatever, exactly what they asked for, and they're like, well, I didn't want that, or I didn't want that kind, or don't you know anything? It's just like totally ridiculous, like, just make it up like crazy making. I mean, it's called crazy making because the conversation is like cyclical about absolutely nothing. Okay, and it's like all of a sudden, like the narcissist is making such like a big deal about the sky is pink. Who cares? I don't care if the sky is pink. It's not like affecting where like the moon is made of cheese. Okay, well, maybe there's like a child's tale somewhere that the moon is made of cheese, but reality, it's not. Okay, I think there's a space rover up there that was actually like sending back data of what type of rocks and space dust, and we're in the crater on the dark side of the moon, so or on the light side of the moon, because I don't know if it could run on the dark side of the moon if it was solar powered. Yeah, I think it's called a rover. Yeah, I forget. I'll have to look it up. I'll figure it out. Yeah, I think it was like last year or something, or yeah, whatever. But and they'll say the moon is made of cheese. Well, the moon is not made of cheese. I'm sorry. I mean, you can, well, I haven't been to the moon. Well, maybe I have been to the moon. I think in another dimension I have been to the moon. Like I said, we had our little experience another time. So, yes, but coming back to reality for a minute. Yeah, so, you get to share, and then the counselor will give their um, feedback first, and it's usually constructive. It's not judgmental, so they're like, well, that's wrong, or your feelings are wrong, or you shouldn't think like that, or you shouldn't talk like that, so that's judgmental. The feedback is usually supposed to be helpful. It is not judgmental, and it's usually done in a way that praises the person for sharing. So after the sharing is done, the first thing the counselor will do is, thank you for sharing. Are you open for feedback? This is not the exact words, but that's basically what it means. Um, and so if you are open, so thank you for sharing. Okay, so you're actually making yourself vulnerable to the group. And that's another way, especially when you're starting out. And I know, because I'm autistic, making friends is very difficult for me. And in order to do that, you kind of have to bring your walls down. So like usually my walls are way up because I've been burned by too many narcissists in a row. It doesn't matter. Again, I forgive the narcissist. I forgive you. Okay, but I ain't gonna forget. And I'm one of them, Mika. Ichiro will always care for Mika, no matter how that goes. But toxic is toxic, and Mika was the only person who was going to get 2 chances. There are no more chances. Solo leveling. Yeah. Anyway, grow stronger. Player. So yeah. Then once the counselor is done with the feedback, then other people in the group can provide feedback. Now, if somebody does, the way the feedback is given is you praise the person for something that was said. You acknowledge their feelings, or that the counselor will do that first. Thank you for sharing. Your feelings are valid. I mean, again, we're not saying these exact words, but making sure that the person who shared understands that this is a safe place. Usually, at the beginning of the group session, I know that we kind of do this before the day starts, before the mindfulness, that the counselor will actually announce this is a safe place, and that there's no yelling, and there's no judgmental, there's no cursing, everybody is equal, and this is a place that's safe for sharing. Now, because we're kind of a PTSD trauma-focused group, that's very important to begin with, because especially if somebody is sharing something that's specifically traumatic, you don't want to trigger them. So, for example, I gave feedback during one of the sessions. Somebody was mentioning something along the lines of, I don't know, relationships or something like that. And I mentioned the fact that as someone who will always be a recovering anorexic, that it's there was something that was said that I had my own personal experience being anorexic, when I was kind of at my, there's been 2 times in my life at my worst, lowest weight, I was able to take my experience, spill the tea, take something from my experience, and use that as an example to provide feedback to the person who shared. Okay. And I'm not sure exactly how AA works. Again, I only went once, and in the hospital it was very different. There was no sharing. But I'll look that up and answer the question probably later. Um, so yeah, so there's sharing, and usually a couple of people share. And then if you have, at the end of that, there's different programs. You would go from one group to your second setting. So if you were dealing with, specifically with like a detox, or you were dealing with something related to first responders, or something that you were doing relating to behavioral, you would do that. You do actually get to meet with your psychiatrist after you do the initial intake, and I'll do a video on how the whole intake process works, and also how the psychiatric evaluation, the psych eval, works in the hospital, so that you know how that goes down. Um, but one of the things that you do get when you go to group therapy is that you actually get a plan, which is specialized to you. So when you do your initial intake to join the group in IOP, intensive outpatient, you do kind of this interview with a psychiatrist or the behavioral health leader, who works on the intake part. And you relay your experience, you relay what you were in the hospital for, you relay some other medical stuff. Then they take the information from the nurse, they take the information from the previous hospital, they take the information from the counselors, all that, which is in your discharge file. Now, they do give you a discharge file, so, supposedly your discharge file, like my discharge file is like 10 pages. Okay, but there's the real discharge file, which is my counselor had requested. I gave my counselor my discharge file, so they had the 10 pages, and then they requested HIPAA again. You have to sign off that they can actually share information, because that's private, against the rules. And I'm going to put a big HIPAA, no you can't sticker right there. Again, my genome is off the table, so don't go anywhere near it. Otherwise, I'll come after you. Okay, so none of that. HIPAA rights don't violate my privacy. So, Americans with Disabilities Act. Patients' rights, behavioral health patients' rights, and mental health advocacy. So after you do the sharing and people give feedback, then you would go to your second group. And then, depending on, you may have lunch, you do have breaks during the day. So when we were in the hospital, there was regular break, so there was outside time so that you could play basketball or soccer or whatever was going on, or just hang out. And then there was also, which I thought was funny, they had smoke break, and like people outside time were like, whatever, okay, I want to go outside, because you're like in the hospital all day long. But it was like, the next thing was like smoke break, and it was funny to see people run across the floor. I mean, they literally would like drop what they were doing and go to smoke break, So I don't smoke, so, the hospital is a non-smoking. Well, it was interesting because when I was in the hospital before, so I've been in the hospital 3 times. Once when I was 19, once a couple of years later, and then this time recently this year. It was interesting that this place had smoke break. Okay, so you actually go outside and you have to either have someone deliver cigarettes, because you're in the hospital, you can't leave until you get discharged. Either somebody, like your family or your friend, can bring you a pack of cigarettes or whatever. So the cigarettes will be capped by the nurse technicians, And then during smoke break, they'll bring them out, and they'll take your pack of cigarettes, and then you can have one of your cigarettes during the time. And people would actually chain smoke, because you only get smoke break I think twice a day, usually two or three times a day, because they had it after meals. They had one in the morning, like before breakfast, and then they had other two. Well, no, they didn't have smoke break in the morning, but they had smoke break in the afternoon after lunch, and then they had it again after dinner. Okay, in the second hospital, that hospital, that was no smoking. So a lot of people came in smoking, but there was no smoking. But in the first hospital, when I was 19, you could actually smoke on the floor. So, I think it was, there was no smoking in buildings at the time. But there was definitely, you could smoke on the floor because you were not getting off the floor. There was no outside time. You were behind the doors. I know, and so I know in the second hospital, I did try to take flight and run to the door. I got real close to the door. There were double doors, two sets of doors. So the original door is like you were in behind the door, okay, and then there's like a hallway, and then there's like the outside into the regular hospital. And I made a mad dash one day. I think it was right after visiting hours or something. The place I was just in recently did not have, you could do Zoom visits, but there was no physical visiting. The second place I was in, there were physical visits. You would go to the common area and be able to sit there and, visit with your person. In each of my situations, I didn't have any visitors. So there were no visitors in the third hospital that I just came from. No visitors in the second. Actually, no one really gave a crap. Nobody knew the third time. The first time, like I said, the narcissist was the only one who's going to get a second chance. Mika. The narcissist is the reason I went to the hospital the first time when I was 19 and severely anorexic to the point of feeding tube. Okay, so that tells you how dangerous narcissistic abuse can be. Now, I'll tell you, there's only been one person on this planet that I've ever loved, Mika. But in the first hospital situation, I actually banned Mika from the floor. So Mika was not allowed on the floor for visiting hours to come visit me. However, somehow, I had it in writing at this specific, there were a couple people who were banned from the floor for me. But I had one visitor, Mika, actually got on the floor. Not sure how. After they were purposely banned. So I'm not sure how that boundary violation got through, but it was interesting. And I'll do a video about what it's like to go into the hospital and then come out. And so you come out to the same environment that you went in with. And the way the environment looks before you go in versus after, it's like two different worlds. And I remember the very first time, so the time I was severely anorexic, okay, so you see that there's words behind you on the wall here. I end up doing that. They're usually my words. Now these are, binary code. Each of these binary codes here actually spell out a word the way that it is. And it does say hacker if you put it all together. But it says hack, it says hacker if you put it all together. I ended up, and there's actually a scene in one of my grid scan books. I think it's either in Grid Scan Honor or Grid Scan Union. I think it's in Grid Scan. It's in book number 9 of the 10. Number 9. I don't remember. I think that's Honor. Is number 9 with Raven on the cover. Side faction clandestine operative who is also a hacker and a mobile frame pilot. When they're on the Mopaz space station, there's Sachi, who is the ace mobile frame pilot, has a psychotic break after his mate pair, or his boyfriend, Nathaniel, commits suicide. And it literally sends Sachi over the edge. And Sachi is schizoaffective, so that the behavioral, it's a mood disorder with schizophrenia. So a mood disorder is like depression. And so bipolar, so manic depression. So you've got both. Bipolar, so you've got up and you've got down. Or you've got hypomanic or manic, and then you've got depression. Hypo, whatever. That's what bipolar is. Schizophrenia is oversimplified. It's hallucinations, paranoia, voices, verbal hallucinations. You can be hallucinations you can smell, and then hallucinations that you can see. And so it is both of those chemical disorders. Depression is a little different. Some people will debate that's a chemical disorder, but schizophrenia is actually different. The brain is wired differently. Kind of like ADHD and autism, the brain is wired differently. It's neurodivergent. And I think, so we're at 42. We'll end this at 444. 44404. 4444. So that is a number that says that your angels are with you. So we're going to have to time this specifically so that we can end it at that exact second. So anyway, so that's group. And after the sharing and after you have your second specific topic, or, PTSD, so we were dealing with PTSD. Or if you're on detox day and you're dealing with addiction, coping skills, and stuff like that. Or you're dealing with behavior adjustment, or things that can change your behavior. So instead of reacting, like you have a panic attack, and how to reduce that, or how to reduce stress, and things that you can do to make sure that you don't have a panic attack. Some groups have yoga. And that's a calming mechanism. So like I said, we did the tapping. So that's a way to calm yourself around in a circle, tapping at different pressure points. And this was focused pressure points. And then there's different pressure points on the body, so on your hands, on your butt, on your feet, on different parts, different parts of your body. That will actually change what chemicals are released in your body. It changes your vibration. So if you're having an agitated vibration and it's going lower and lower, if you do the tapping, you can kind of change your vibration and raise it, so that it's in a more positive energy, and that will end up calming you down. And depending on if you do it right or have the technique right, so you get the intent, do the tapping, do the different locations, or you can just focus on your head, then that will can calm you down for a long period of time. So even though you're only doing the tapping for a couple minutes, or maybe 10 minutes or something, that can actually calm you down all day long. So we are almost at the end of our time now. So I want to thank you very much for tuning in. So we talked about what is group like, and what does a typical group happen. And so peace and 444.